There. Should we do it again?
Yeah, let's go.
Let's do it again.
The goal of our therapies is not to help the individual appear more neurotypical. We are embracing the neurodiversity and we're empowering the individual in that.
So co-treat means like co-treatment, so it'll be a speech therapist and an occupational therapist in the same appointment time, but accomplishing their specific discipline goals. Because we're in different disciplines, speech and OT, my treatment approach is going to be in the lens of the occupation, so the thing that is taking up time and is meaningful to the child. Yeah, we want therapy to be something that they're excited for and coming into services each week really happy and excited to accomplish their goals.
JJ.
And research shows that an interprofessional collaborative approach to therapy yields better success in the long run. So here we really try to focus on collaborating very often so that we can make sure we're hitting the things that we need to each week. And when we do a co-treat, we might be targeting different areas, but we are still looking through what the strengths are, what we need to do in terms of helping the child regulate better.
A lot of times, neurodivergent individuals will have lots of sensory needs and they need to be regulated before they can learn. So what OT and speech co-treats can help with is Catherine uses her lovely strategies to help regulate the sensory systems, and then that helps the child be more ready to learn language. When we ignore those sensory needs or those emotional needs, it can prevent the child from being ready to learn. At the Speech and Language Center, I feel like we have a really unique team in that we are all incredibly collaborative and supportive of each other. We are in constant conversation and constant learning from each other on how to incorporate strategies into our sessions that might help address the whole child.
We want to celebrate the child for who they are, and so we're not trying to have them meet certain criteria that society has set up for us. So if there's something that they are passionate about, if they have special interest, if there is something that might feel a little bit off to society or a little bit different, we still want to celebrate and embrace who they are if that's something that's meaningful and is part of who they are. It's a really important thing that we want to keep on the forefront of our mind, is that we don't want people to feel like they need to mask. It's a safe place here and it's a place where they can be themselves.
I think the most rewarding thing that I've seen is the empowerment that comes from it, both in the client themselves and in their families. And forming that relationship and that deep connection, we're able to instill that sense of empowerment in them, and I think that's really important.